Well, hello, everybody. This is Dr. David Jockers, and today I'm talking about the top 10 natural remedies to stop snoring. And so when we look at the statistics out there, we know that snoring is really an epidemic. I mean, 65% of all partnered adults say their partner snores. So a lot of people don't think they snore, but then when they start sleeping next to somebody, they find out pretty quickly that they do. In fact, 43% of adults age 35 to 44 are losing sleep due to their partner snoring. So it can really affect the opposite partner when there's snoring that's taking place. In fact, separate beds, 24% of couples either sleep in separate bedrooms or are at least considering it. Pregnant women can even snore. Typically, the snoring is male. Like you can see here, the statistics, 40% of males, 19% of females. However, pregnancy can bring on snoring as well. And so when we look at the snoring diagram here, we can see a number of different issues anatomically that can contribute to snoring. One is that the uvula, so this little flap back here in the back of the throat, ends up vibrating during the inhalation, creating the snore. And that can oftentimes be the case when somebody has extra fatty tissue back there. Also, when they have hypertrophic tonsils, meaning that the tonsils have overgrown, they have enlarged, or too much of a tongue can also cause snoring, right? Cause issues back there. And then the nasal cavity, if there is polyps or if there's a deviated nasal septum, that can also cause airflow distribution issues and lead to snoring as well. So the body's got to work harder when this is the case. Whenever we have any of these issues, the body has to work harder, and that increased workload can end up causing this uvula to flap, right, as it kind of goes back and forth, causing the snoring sound. All right, so these are all possible mechanisms, and actually I have an article that accompanies this video that goes into this a lot more detail. So 14 main causes of snoring. Well, certainly lifestyle issues like smoking, drinking alcohol, being overweight, enlarged tonsils, deviated septum, nasal polyps. So I talked about some of those anatomical issues. Obviously, an elongated uvula plays a big role with that. Allergies, because then you're more congested in general, or if you have a sinus infection, can certainly cause it. Now, the ones that are more hidden are going to be your food allergies or sensitivities. So typically, a food sensitivity, like if you're sensitive to dairy or gluten and you're consuming those foods, typically it can contribute to congestion, and it can contribute to this sort of enlarged tonsils, this overgrowing of the immune organ, the tonsils, when you have food sensitivities, which can lead to snoring. Eating too close to bedtime is another big one because the body's trying to digest food, puts more stress in the system. Chronic mouth breathing, this is a big deal, and this is something that we definitely want to be able to address. I have another video all about mouth taping, and in the article that accompanies this video, I actually have that video embedded. So be sure to check that out, and you can go through that because mouth breathing is a really big deal. Most people out there are mouth breathing, and when we breathe out of our mouth, it's correlated with our sympathetic nervous system, part of our nervous system that's helps our body with fight or flight. So it's a survival-based mechanism, such as if we were running away from somebody trying to attack us, we need more oxygen. So we're breathing out of our mouth so we can get more airflow in and extract more oxygen. As opposed to if we're relaxed, if we're calm, normally we can keep our mouth closed, we can breathe out of our nose. So nose breathing tells the body we're in a safe place. And that's really where we want to be when we're sleeping. We want the body to have an underlying parasympathetic tone, and that's going to help with healing and repair. And so something as simple as mouth taping, or actually take tape, put it over your mouth at night before you go to sleep, can make a big deal with how you are breathing and affect your quality of sleep, and also reduce snoring and a lot of other effects. In fact, a lot of dentists are talking about the detrimental effects of mouth breathing and how it affects dental health, increasing the risk of cavities and other issues with your oral health. So definitely issues to address. Now, sleep apnea, I will do a video coming up on this, but if you're noticing these symptoms, these are very much associated with sleep apnea. So if you are depressed and moody throughout the day, very fatigued, having memory loss, You've got a headache when you wake up in the morning. Really common symptom of sleep apnea is this dry mouth and morning headache. That's probably the most common symptoms, along with snoring, of course. You might be waking up, every hour or something like that, just never feeling really refreshed. And it can also affect your hormones, causing things like impotence or just total loss of libido, fatigued, brain fog, because again, your body needs to recycle while you're sleeping. It needs to filter and detoxify the brain. And so if you're not getting really good high quality oxygen while you're sleeping and not getting a really good deep sleep, you're going to end up with brain issues, memory loss, attention deficit, depressed, moody, sometimes anxiety, fatigue. So these are all common symptoms associated with sleep apnea. Now, things we can do is certainly change our diet. An anti-inflammatory healing diet, I highly recommend that. If you're overweight, definitely losing excess weight. Fasting, intermittent fasting is one of the best ways to regulate your hormones. So whether you do something like consume your meals in an 8-hour eating window, maybe even tighter, maybe like a 6-hour eating window. So like you're consuming your meals between 10 a.m. and 6 p.m. or 12 p.m. and 6 p.m. And then outside of that, you're just drinking water, maybe herbal teas, maybe just a straight black coffee, but not consuming calories outside of that. You want to consume smaller meals, particularly near bedtime, right? If you're consuming a very large meal close to bedtime, not a good idea. So you want to consume smaller meals, particularly at bedtime, particularly in the evening. If you're eating after 6, let's say, like if you're eating before 6, should be fine eating a larger meal, larger dinner. But if you're eating at like 8 o'clock at night, and trying to go to bed at 10, better to consume a smaller meal. Use essential oils. There's a lot of good oils out there like lemongrass, chamomile, passion flower. These are all really good essential oils that help promote good sleep. Mouth taping. Again, I have a video all about that on my YouTube channel. Also, you can find it on the article that accompanies this video here. That's right at the bottom. You can see the link. Change your sleeping position. Sleeping on the back is very much associated with snoring. So I recommend side sleeping. And actually, in the article that accompanies this video, I go over how to sleep on your side properly. I see a lot of people actually injuring their spine because they don't have the pillows set correctly when they sleep on their side. So I go over some good tips in that. Practice good sleep hygiene. I'll talk about that in a second. Take care of your sinuses. You might need to rinse your sinuses out on a regular basis. And of course, avoid stuff like sleeping medications can certainly induce more snoring, smoking in general, alcohol. So drinking a lot of alcohol before you go to bed, not a good idea. Now, healing diet. Number 1, reduce sugar and grains. Get grains out. Get processed sugar out for sure. Processed food in general, get it out. Get rid of bad fat. So corn oil, cottonseed oil, sunflower oil, canola oil, peanut oil, soybean oil. These are all really bad fats. We want to avoid those. Instead, we want to add a lot of good fats. You see in the picture, there's avocado. Avocados are amazing. So avocados, avocado oil, olives, olive oil, grass-fed butter can be really good if you handle dairy, coconut oil, coconut products. These are all really good, healthy fats that you can be consuming, pasture-raised eggs. Change the meat that you eat. Get rid of commercial-raised animal products and go with grass-fed, organic, pasture-raised, properly and sustainably raised animal products. They have a lot more nutrients and a lot less environmental toxins. These are really the 3 big steps to a healing diet. Now, 7 strategies for better sleep. Get some sunlight each day. Try to get outside for at least 10, 15 minutes and get good high quality sunlight. Earlier in the day, the better. That's going to help naturally stimulate a good, healthy circadian rhythm, which will help you feel tired in the evening and fall asleep effectively. Try to avoid artificial light as much as possible. Like I'm sitting here doing this presentation in my home office and I don't have any lights on. Like I have a window and there's some daylight coming in that, but I don't have any other lights on because I try to avoid exposure to artificial light as much as possible. And, especially in my home where I can control it a little bit more often. Black out your room. So keep your room as dark as possible. You can also use a eye mask. I'm a huge fan of an eye mask. Forming healthy sleep habits. So basically what you want to do there is go to bed at an early time. So I recommend, at least at the latest going to bed at 11 p.m., ideally more like 10 p.m. and try to wind down well. So you should have the electronics off at least 30 minutes before you go to bed. Wind your body and your mind down as well as possible. Turn off a lot of the lights so you're not exposed to those things. You can use blue light blocking glasses as well. That can be really helpful. And really try to calm your body, maybe some light reading or talking to your spouse or loved one, or saying prayers and visualizing your next day. Those can all be great habits. Balance your blood sugar. So consume this sort of healing diet is really important. Smart caffeine intake. So you don't want to drink, and most of you guys know this, you don't want to be taking in caffeine really after 2 p.m. Okay, so typically caffeine is going to have like an 8-hour window or so, 8-hour half-life to it, or life, I should say, to it. So you wouldn't want to consume it after 2 p.m. in order to sleep well. Okay, and then of course tame your mind, relax, visualize, meditate, listen to like a guided meditation. These are really good things to do at night. Listen to scripture, some light worship music, light inspirational music can be really, really helpful. Okay, now strategies to heal and prevent a sinus infection. These are all good things to be doing. Cleansing diet in general, herbal teas. So herbal tea can be really good, especially like echinacea tea can be really helpful. There's a nighty-night tea that's really good from traditional medicinals, and it's got things like passion flower and chamomile and stuff like that in there. We talked about using essential oils. Some great supplements to help with sinuses are going to be vitamin C, zinc, and particularly vitamin C with bioflavonoids. And we have one on our website called Super C. That's what I would recommend. A good high quality vitamin D, zinc. And if your sinuses are really bad, getting a good nasal or mouth spray that you can be spraying, like an antifungal spray, can be really helpful. Consuming a lot of garlic and onions, very helpful, and diffusing essential oils. And then also these nasal strips. People ask me about these all the time. Do these really work? They actually do work pretty good. They're going to help open up your sinuses. So they're going to help expand the sinuses and not allow them to kind of close down. And that can be really helpful for getting the airflow at night. So people with deviated septum seem to do really well, particularly with this, but also people with congestion. So very, very good idea to use some of these nasal strips. And I have a link to the ones I recommend in the article that accompanies this video. So hopefully this has been really helpful for you guys. If it has, please give me a like on this, and also leave a comment letting me know what the most powerful thing you learned in this video was. And so again, appreciate you guys' time, and we'll see you on a future video. Be blessed.